Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about the audits, the medical coding audits. If you are just joining me, welcome to my channel. I am Blue. I'm a medical coder. I've been a medical coder for over 10 years. I created my channel with the hopes of sharing the things that I know with all of you, whether you are a veteran medical coder or you are a brand new medical coder or you are just curious about the field. I hope you'll take a second and hit that subscribe button and hit the notification bell so that you can be the first one to know whenever I post a new episode. And if this video at the end helps you, I hope you'll take a second and share it with your friends. All right, so let's get started. All right, those dreaded audits. Yes, they are a fact of life for all medical coders. Whether you are working in a doctor's office or you are working in a hospital, they are a fact of life. Now, why do we have audits? Why do we have medical coding audits? Well, quite frankly, to make sure that we are coding correctly. And if we aren't, to make sure that we don't continually make the same mistakes, okay? Or perhaps we need to become sharper when it comes to the specificity of the codes, okay? And that's a lot of what an audit is. Now, it is very difficult not to take audits personally. Trust me, I've been there, done that, and got a t-shirt. Believe me. I hate it. I hate when I get that sinking feeling like it's personal, like it's a personal thing. It's not a personal thing, and you have to sort of go against that feeling because of the simple fact that the person that is auditing you is a human being too. Number one, it's their job. And number two, I'm sure they don't like to tell somebody that they're wrong. Some people get a joy out of it. I get it. But for the most part, an auditor should be a very good educator at the same time. Now, not every auditor is good, okay? And now I'm just being frank, okay? You guys know me. I say things the truth, and I don't mince words. Sometimes you'll get a good auditor, and sometimes you won't. Sometimes when an auditor tells you that you are incorrect, they won't tell you why. And to me, that's wrong. If you're going to tell somebody that they're wrong, especially a medical coder, you need to explain yourself and why it is that you are correct. So that way the coder can learn and continually get better. It's all about getting better. It's about being a team. Whether you are being a team with your auditor or you're being a team with your provider, everybody needs to work together as a team. And the only way to do that is to communicate. Now, so this is, let me go back a little bit. How many audits do you get, and how often do you get audited? It depends on the facility. Every facility is different. Some facilities will audit you once a month. I work in my facility, I get audited once a month. And how many of it is it? How many records get pulled? Again, it depends on the facility. We don't get very many records pulled, which is a bad thing because of the simple fact that if you make one error, it can kill your accuracy. So you really have to be careful. And for some facilities, it is a percentage of the records that you touch, okay? And if you're a brand new coder and you're starting out and it's your first job, they will audit 100% of your work to make sure that you're on the right track before they just turn you loose. It's called a pre-bill period. Most places have that because they want to make sure that you are, in fact, coding correctly and you didn't just pass their interest assessment by just a stroke of luck. They want to make sure that you really do know what you're doing. It's very critical when you are working in the medical coding field to be accurate and to be as accurate as possible because patients can get charged the wrong amount if you end up coding it incorrectly. A provider could potentially lose out on credit because you didn't code it correctly. A facility can get shut down if the coding is not done correctly. That's how serious it is. It is a trickle-down effect, okay? We touch a lot of people without really even knowing it. And a lot of times people don't really think about all the ramifications that go along with it. But that's part of it. And that's why the hammering about the accuracy is so huge, and they want you to be as specific as possible, and they want to make sure that you're following the rules, and they want to make sure that all the credit is given credit, okay? Now, There are some times when you are going to know something that your auditor does not know. It happens. They don't know everything, okay? Medical coding is a continually learning process. I'm not joking. There will be times when you do know more than your auditor. There will be times when your auditor will know more than you. So if you are working well with your auditor can tell you, well, you made this mistake, but here's why. This is what happened. You coded it this way, this way, this way. And actually, according to the book or according to this reputable website or according to this guideline, it should be coded this way, this way, this way. And then if you say, oh, okay, oops, so then you just go and you correct the error and move on. That's the thing. You can't get hung up on these errors, and you can't get so nervous that you start to slow down on your production. You have to be able to maintain your production and still know that you may end up getting some kicked back because it was wrong. So that's why you have to try to be as accurate as you possibly can. Again, we're all human, and there's going to be times when you miss something and maybe you forgot, or maybe there was a slip of the finger. That happens to me when I'm going too fast. Sometimes there will be a slip of the finger, and I'll know it's a slip of the finger error because when I see the error, I'm like, oh, and I'll know I did it, and I'm like, and so my boss will tell me, Blue, what happened? And I'll tell her slip of the finger. It doesn't happen a lot, but it does happen. And she goes, that's what I figured, because this does not seem like you. This is not something that you would do. So I say, okay. So, and I move on from it. Okay. You have to be able to move on. But if you get an error, and they will give you time to review your errors and either correct them or send them for mediation between you and the auditor. Okay, and the auditor will either be your supervisor, somebody from data quality, or maybe a lead. Okay, it just depends on who's doing the auditing. Okay, and for some facilities, they have a separate data quality people that do it, and so that way I guess it can remain neutral as possible, because if your supervisor is working with you, obviously you guys are going to build a relationship, and sometimes it may be harder to mark somebody wrong if you know them. Okay, you don't want them to be wrong, but again, that could be why they have data quality folks in a separate area. Every facility is different, so you would have to ask. Okay. But if you happen to get an error, and this error is, is incorrect, okay, because you have full understanding of what it is that you coded, you know why you coded it, you know how you got to it, this is when you need to go and send it for mediation. And don't be afraid to say, I disagree with this one, and I'll show you why. Okay. Sometimes people say, oh, the auditor marked it wrong, so it must be wrong. No. If you know that you coded it correctly, and you can be a brand new coder, you could be a veteran coder. It does not matter. Your auditor can have a whole full alphabet after their name. And what I mean by when I say alphabet, I mean like credential. It can be very impressive, but they can also miss something too. Okay, so always go and say, I disagree with this error, and here's why. Bring your evidence, bring your proof. Now, I always talk in terms of in legal terms. I always talk evidence or something to back up your argument. I wanted to go to law school, okay, and I was far away from medical coding. So it always stayed with me. I've been like this since I was a kid. Okay, that was going to be my life. I was going to be an attorney, and that was it. But that didn't go. Okay, I am a medical coder. This is what I'm supposed to be doing. But I never lost that jargon in my head of I'm going to present it this way. I'm going to present my argument this way. And, I'm the strongest litigator in the world when it comes to arguing my case. When it comes to, I know I got this right. Anyway, bring your proof. When I tell you guys to bring your proof, if you got your codes, right? If you got your codes or your procedure, if you got them because of your understanding of this passage in the book, or whatever the case may be, because of how it was documented, then you need to bring the evidence that says that you are correct. The CPT book, or if you're coding inpatient, the ICD-10 PCS book. You can go to your Merck manual if it's a diagnosis issue. You can go to a coder desk reference for procedures, a coder desk reference for diagnosis. Shout out to Optum 360, although this is not an ad. Optum 360 has some amazing books when it comes to references to help medical coders. And these books are official, okay? And so that you want to check out, okay? Because those references are very valuable, especially when you're trying to argue back an argument to somebody who's decorated. And what I mean by when I say decorated, mean like they've got their credentials behind their name, or they've got lots of experience. So you need to make sure that you are willing to make that argument, and don't be scared, because if you are just going to let them say this wrong, it's wrong, it's wrong, then you're wrong. You're wrong, and you cannot be complacent. You have to say, okay, let me make sure that I understand this. So you're saying that this is wrong because of this, this, and this. Well, I have this proof here. This is why I selected that code. And if you present your argument well, then the auditor may say, whoa, they're right. Okay, I'll go ahead and give this back to you. And then guess what happens to your accuracy? It goes right back up. And then what happens next is this auditor knows that you're trying. This auditor knows that you are working to understand better the medical coding field, because believe me, this is not always the case. Some coders will say, oh, well, the auditor marked me wrong, so I'm going to go ahead and accept the error. No. Do not accept the error if you know the error is not technically an error. Now, if it is an error, do not continue to argue when you know that the auditor is correct. If you know that the auditor is correct, you know that you made that mistake, own it and say, okay, and learn from it, and don't do it again. Because sometimes people will say, well, they marked me wrong, but I'm going to continue to do it because I feel that this is the correct way. No. If the auditor has proven that your argument is incorrect and they have their stuff to back it up, then you need to accept it and move on. And you need to do it the correct way, even if you feel like it doesn't make sense to you. If it doesn't make sense to you, then you need to figure out why it doesn't make sense. Now, sometimes it could be just a matter of not really fully understanding like what happened, or it could be the language of the procedure code or the language of the diagnosis. And so that's when you need to really concentrate on those things, because when you concentrate on those things and you better fully understand them, the better off you will be. Now, I have had before my boss now, and my boss now, we go back and forth. I mean, it is okay when she tells me you've got an error. So okay, let's make sure that I really do have an error. And so I'll make sure that I'm prepared and ready. And she likes this. And so we go back and forth. But the auditor that I had before her, she's I don't want to say it without I can't say it without sounding mean. But you guys know me. I'm not gonna I mean, I believe everybody has a potential to do the right thing when it comes to coding and be a very good coder. But in this case, her experience, her experience was not a lot when it came to this particular setting of coding, okay? And so I had to train her when I started, okay? When I started, I trained the auditor to audit me, which is weird and backwards, but it's the truth. I had to train her because she had no experience in that particular setting. And so because of that, I always kind of felt like there was a little bit of resentment there, because every time she tried to mark me for an error, I was able to present the evidence that says that I was correct. And we did actually have to go because there was an error that she would not give back. And she was fighting me the whole way. She's like, no, you're wrong. And my accuracy at that point with that error was at 98%. I said, no. This is in the book. This says this. This is the reason why. She refused. So I said, okay, then this needs to go to mediation. And when I ask to go to mediation, it needs to be a mediator that is a neutral party between me and the auditor. So it'll go up higher. So I went to the chief, and the chief says, the chief happened to come into the office. And so she says, okay, we'll settle this right now. She called the chief over and she says, ma'am, can you look at this and can you tell us how you would code this? She didn't say what her argument was. She didn't say what my argument was. She wanted to see what the chief would say. Guess what the chief said? Hello. So I just looked at her. I didn't say anything. And of course, the auditor is mad. She is mad now because I proved her wrong. And I'm not doing it to be argumentative as far as like, I'm going to always make sure that I'm correct, because I know that I'm not always correct. That I know there are times when I need to learn something too. And even being a veteran medical coder, I know this. I'm okay with this. This is fine for me, okay? Because I'm always going to continue to learn. Like I said before, I'm okay with criticism, but you need to explain to me why so that I can get better. That's the only way. That's the only way you're going to get better, is if you're not afraid to accept that criticism, okay? So, but moving on, but she was mad. She was upset about it. She had hurt feelings about it. Now, her personal feelings towards me were not my problem. Even though, yes, she did try to make it a little bit more difficult, but she did know that I'm going to become prepared. I mean, I have to be prepared. There is no, oh, I disagree with you. Why? Oh, because I disagree. No, I'm always going to come at you with facts, okay? That's the way I am, because I don't believe in sugarcoating nothing, okay? Because why? We are in a professional work environment. What I do is not because of me. It doesn't only affect me, because obviously if I do the coding wrong and then, we're all out of a job. But what I do affects my providers. Now, back then, I didn't have the established relationships that I have with all of my providers now. They were just names on paper because they housed us away from our providers. Now we are in a big, beautiful, brand new hospital that we've been in for a few years. And now we have that established relationship with them, which has made my knowledge and my passion for the field really grow, because now I have a face with the name. I have a relationship, and now it's personal. It's even more personal that I do things correctly, because it is for everybody. And of course, there are going to be some providers that you favor more than others. But for me, in my mind, everybody gets treated equally. Even for the ones that I know that don't favor me. And there's a couple. Actually, there are a couple. But it's a myriad of things. And I'm not going to go into why. But there are a couple. But I still work hard for them. I still push and try to make sure that I get them the most credit that they are actually entitled to. I'm not going to punish them because they don't favor me. I don't care. Their feelings towards me, it doesn't matter. What I need you to do is your job. What I need you to do is make sure that you're documenting like you should. What I need you to do is make sure that you're attending these classes when I am giving guidance, so that way you can fully maximize what you're documenting, so that way everything is clear and everything is understood. Okay? There is no ambiguity. That is one thing that it cannot be in medical coding, is ambiguity. We need to have clarity. Everything needs to be clear, okay? And so that's why I stress this. And I even tell them, I said, whether you approve of my methods of teaching or not, which are unconventional, because I am very hands-on. I don't do anything weird. I'm just more active, and I talk to them and I send them coding tips of the week and things like that. So I didn't mean to stray, but when you do have good relationships like that, it does sort of go hand in hand with the accuracy, because the more clear the provider is in their documentation, the less ambiguity that you have to work with when you are trying to settle an argument with an auditor. Do you see how the whole thing goes? I'm telling you guys, it does get to be like, but it's true, okay? So, but for this auditor to round out the story, I didn't have to be around the auditor very much longer after that. I got moved on to my supervisor's team, which was fine with me. Because the thing is, I think that it's okay when people have a personality conflict. The personality conflict was on that auditor's end, not mine. I still maintained being a professional, and that you have to do whenever, especially, you are arguing your point, okay? You have to be respectful and you have to be prepared, okay? Because don't roll over just because the auditor says it's wrong. And there's going to be auditors that will tell you that this is wrong. And if it's not wrong, then you need to say that this is correct because of this. I have a coding clinic, or I have the Merck manual, or I have the coder desk reference, anything to back up your argument. Okay, so learn from the audits, and it's going to happen every month. If you have monthly audits, it's going to happen every month. And some places it's every few hundred records. They will take a sampling of it, every few hundred records, and then bring you in and say, okay, this is your accuracy currently. These were your errors. Do you agree or disagree? Okay, and then you have time to review. Okay, so there's always going to be time to review. It's all about learning. Okay, and when you get on board with learning, the better off you'll be. Okay, but if what the auditor is telling you is incorrect, I'm going to say this again, make sure that you are prepared to stand up for yourself and say, well, sir or ma'am, I have this that shows this. Can we come to an agreement here? It's that simple. And whatever you do, do not get loud. Sometimes auditors will get loud because they are human too. And sometimes I've seen coders get loud as well. Don't get loud, okay? Yes, it may be an impassioned argument, but don't get loud. Is whatever you do, try to control yourself and your emotions and your behavior as much as you can. And just because you have one bad audit does not mean you're going to get fired, so relax. Audits are a way of learning. I've said it and I'll keep saying it. Audits are a way to learn. If you keep making the same mistakes, then yes, you have a problem, because then obviously if you're making the same mistakes, why are you making the same mistakes when you've already been instructed the proper way to do the coding? Okay, so it is a little bit of onus on the coder, right? To make sure that we know and we understand what we're doing. And even if you feel like you don't understand, try to reach out, find a mentor. You can ask questions here, but my rule is this. It has to be very specific. You have to have done your research, and you have to tell me and you have to show me how you got your answer or what you're using to back up your argument. And then if it still doesn't make sense, then you can tell me all of this and I will help you. I don't mind doing that. But when you're giving me very general questions and help me to know how to code, okay, I can't help you if you don't tell me how to help you. And I need you to tell me how to help you because everybody is different. And that's, I mean, again, it's very difficult especially when I do quizzes, because everybody's knowledge base is different. So I have to sometimes I make them too hard, and people tell me, Blue, these are too hard. And I'm like, okay, then I try to, bring them down a little bit. Oh, this was too easy. Okay, well, then I just have to make it hard again, so it just depends. Everybody, like I said, everybody is different. But I hope that with my videos, and I hope that if you're curious or you want to know more, that you go through my videos, because I do talk in detail about like injury coding, which I love. I'm an orthopedics nerd, podiatry nerd. Okay, I love orthopedics and podiatry, and that is my specialty. Okay, I love injuries. I love doing injury coding. That is where my strong suit is. I'm also strong in evaluation and management. So, but anyway, yeah, take a look through my videos and see if any of those videos answer your questions, okay? But again, if you have any questions, just let me know, all right? I'm going to go ahead and wrap this one up, but Wasn't this fun this week? I think this was fun this week. I like that I knew every day like what I was gonna have on that day. So I already have next week's schedule for videos out. So I hope you'll join me. I will be posting it in the community tab on YouTube, and I will also be posting it on my Instagram at medicalcodingwithbleu, all one word. All right, I will go ahead and wrap this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Have a great weekend. Bye.